I'm going to start with a moment of reflexivity, so you have a sense of what shapes my worldview. And I would say there are three realities that shape what I do. The first is that I am made and forged in Lagos. I am designed in London, and I am matured in Cape Town. The second is that I am an avid user of public space, a one-time ultramarathon runner, now just a regular runner, but never happier than when I'm running the mountains of Cape Town, as my deranged expression there alludes. And the third is that I'm a public health physician. And what that essentially means is that my patients are not individuals, but my patients are cities. I work with my patients to run diagnostics, to say, let's have a look at your organs, what helps you breathe, what determines how you eat, what helps you move. How do we diagnose what the issues are? How do we treat those? What is already healthy, and how do we actually keep that healthy as you age as a city? So bringing those realities together, you can see that I'm drawn to complexity, public space, and that gives you a sense of how I work, so at these crossing borders. I like this photo. It's just a random photo, but I think it captures the essence of many aspects of what I do. This photo was taken at a transport interchange in Lagos in the middle of the first lockdown, where people, with the sudden emergence of safe public space overnight, people took to the streets unorganized and partook in physical activity. I like it because it has a bunch of different things. We have the transport infrastructure, we have public space, we have participation, we have obesity prevention. We also have the tension and infection control, because you think, oh, great, you're doing physical activity, but it's a pandemic. But it really highlights the tension between all the different components of what I do, and we'll touch on some of these. This is a three-part story. I will touch on why we need to rethink health, spend a bit of time on the reimagination of cities, and what that could look like, and I would argue for the need for rethinking and reconsidering innovation, and end with calls to action on how we can move forward on this. So firstly, in terms of rethinking health, I have three maxims that really cut across all the work that I do. The first is that health is much more than healthcare. This is a photo, again, from Lagos. And this is the kind of things that people think about when you think about a city, right? So lots of people, lots of traffic, maybe tall buildings. But I see, I'm an urban epidemiologist, I see urban exposures. So in the middle here are my S's of urban exposure. Now, here's the caveat. I started with some S's, so I thought sugar, salt, sleep, and I got a bit carried away. So the rest of the S's are a little bit contrived. So for example, whilst we know that shots, which is healthcare, I told you a little bit contrived, influence our health outcomes, we know that by and large, over 80% of the factors that influence our health lie outside of healthcare. They lie in the food environments that inform what we eat, so sugar and salt environments. They lie in the air we breathe and our exposure to air pollution. They lie in what determines how much sleep we get. And if you look, and we go even further up, our access to healthy foods, our access to public space, these are the factors that really determine our health. They influence health in lots of different ways. And so what I do in my work is to ask, how do we better make these connections between these urban exposures and the behaviors that we want to embrace in order to stay healthy or to prevent or to control disease? And critically, how can we harness these urban environments to create health and do that in measurably sustained and equitable ways? The second maxim is that health does not trickle down from good intentions. And I say this because health is often used as a synonym for good, right? So if the intention is good, then it must be healthy. But the thing is, the evidence doesn't bear that out. An example of some work that we did with partners in South Africa, where we looked at the impact of a voluntary pledge by a major beverage company. There was a voluntary pledge to stop advertising and reduce availability of sugar-sweetened beverages in primary schools across the country, particularly the province. Good intention. Outcome? Non-existent, right? This didn't work. We have to measure the impact. On the other side, there's a study that was conducted in Wales that looked at the impact of upgrading social housing in a city and looked at the impact on health. And they found that over a 10-year period, upgrades are related to ventilation, related to thermal regulation, related to lighting, related to access to green space, reduced emergency hospitalizations by 40%. We don't know if we don't measure. Good intention, good outcome. And similarly, we know the study from the US that looked at drops in air pollution during the lockdowns was associated with a significant drop in heart attacks over a short period of the first year of the pandemic. This is the power of measuring. We cannot assume health trickles down. And the third maxim is recognizing the pillars of sustainable, healthy urban development. And these are the three pillars I use as a crutch, right? So the first is thinking about health as investment. And I say that because we often think about health as a cost, but we little think about the cost of inaction, right? So this was an example I put there. In 2018, in 1 year, air pollution alone in Lagos accounted for 2% of loss in GDP of the state. So the cost of inaction, we have to see health as an investment. We have to have systems that focus on prevention, and this is particularly so on a young continent. It's true in general, but on a young continent, the potential to optimize human and economic development really vests in keeping people healthy. And the third is a move from thinking about health just as a siloed sector to thinking about planetary health, by which I mean the interlinkages between human health and the natural ecosystems that we depend on. And so we can see that in order to actually rethink this health, the health in this way, we will need to reimagine cities, because at the moment, cities are not working for us in this way. And the reason we see, particularly in the fastest growing cities, we see human settlements pushing the boundaries of ecology and disrupting ecological boundaries. We see it in terms of human settlements and housing being built in informal and dense ways that facilitate transmission, but also that increase vulnerability to disease by increasing exposure to unhealthy environments, to inadequate urban infrastructure. And so the rest of my talk would focus on the African region, not because the issues and the solutions are unique to that region, but I really believe that the potential for impact is greatest on that continent, and here's why. It's the fastest growing continent and one of the fastest urbanizing. This is an image of the number of people moving into cities across the world per hour, right? Look at where we are and look at where Lagos is. When we start getting a sense of how quickly the cities are growing, we understand that if we can harness this for health, there's a potential for significant population health, increasing population health. The other reality is that the median age on our continent where we are now is 42. The median age on the African continent is 19. How do we talk about health in the same way, right? So we have to, the opportunity to maintain and protect health should be a priority. And we have the aspiration. So we see that in the African Union's roadmap for the Africa we want by 2063, which spells out health and well-being, which spells out inclusive, sustainable cities. But the challenge is, the presumption is that health trickles down from good intentions. We assume that we will develop and we'll grow the cities and people will just get healthy. And we know that is not the case. And so I ask, what if health-enabling, climate-resilient environments in cities was a central guiding principle of all urban development? This is my vision, and this is what I would die happy if it happens, not by 2030, I would hope, but that in the next 10 years, we work to incorporate health, particularly planetary health, recognizing that balance between health and climate resilience into all large urban infrastructure initiatives across the African continent. And that by 2063, the African Union target that this particular mission is youth privileged and youth led. And so what I do in my work is thinking about how we rethink and how we can shape urban infrastructure design and development, and thinking about particularly the air we breathe, our places and spaces, and the food we eat. So those are three aspects of public space, if you remember from the beginning, that play a critical role in our health. They also influence our climate resilience. So we know, for example, that air pollution clearly impacts our respiratory, our cardiovascular, our brain health, but the majority of air pollutants are also greenhouse gas emissions, right? So we know from our places and spaces that access to green, inclusive, safe spaces are really critical for our physical and mental health. But we also know that we're going to have to think about heat resilience and flood resilience when we're shaping cities in this way, given the climate realities we're confronted with. And thirdly, from a food perspective, and we heard about from nutrition today, why it's so critical that we have equitable access to good food and healthy food. But we also have to think about the climate resilience of our food systems and ensure that we're not compromising biodiversity at the expense of what we eat. And so I see these as critical health infrastructure. So if you ask me, and I'm a medic, so I say I'm a reformed medic. If you ask me what I see as critical health infrastructure, these are the things that I focus on. But we will need to be bolder in how we think about health. I wrote this in 2020 in the first few months of the pandemic, in part because I was exasperated by how we talk about resilience, right? We talk about how we need to be resilient and adaptive to these shocks, but I felt like what was missing was a recognition that the vast majority of the acute and chronic shocks and stressors arise from intentional choices by actors across sectors from local to global. And so if we talk about building resilience, we have to confront those upstream determinants that drive our systems towards disease, that weaken resilience, that drive our systems towards ecological vulnerability. We can't simply just wait for things to happen that we are in control of and then talk about resilience as a reactive issue. But this will need a demand and supply, right? So I talk about how do we increase the demand for healthy places, but how do we also increase the supply of health from place? This is a study we conducted in Yaoundé and in Lagos, where we wanted to understand how people are using public space for physical activity and what health risks they face. So this was a citizen science study where we asked people, tell us about public spaces in your city that either you use or you see other people using. And one of the really interesting things was the imagination. So what you think, or what I thought about public space was a fraction of what was being used. And what we saw was really an unmet demand for healthy places. This is a guy doing squats in the middle of a roundabout. Yeah. This is a plank on a bridge. This was a group of a sports team, but doing sit-ups in a car park outside of a stadium. There is a vastly, so in public health, we talk about people need to be more physically active, people need to eat more. That is true. But people are also crying out for places that are supportive of physical activity. And so we ask, how can we take an asset-based approach and understand what people are already doing and how we can actually shape spaces and places to be better supportive of these activities? And by the way, they were doing, if you think about the injury risk, think about the safety risk, we also measured air pollution. And so you want to support this physical activity, but actually they were doing it at unacceptable risks. In terms of increasing supply of health from place, just a couple of examples. This is one from the African Development Bank's African Development Institute, and there was a matrix of policy options that was developed again around 2020. It was around thinking about building inclusive health systems, inclusive health post-COVID in Africa. And one of the things I really liked about that, I'd extracted from, for obvious self-interest reasons, was the presupposition that we could think about urban development practitioners and funders and planners as health professionals. So if we talk about our health professionals today and you called upon, if you were ill and you had to think about who your health professional was that you would hold accountable for your health, we normally think about the NHS, we normally think about healthcare. But we don't think about urban planners, we don't think about the developers, we don't think about the regulations around what food we have access to. These are the health professionals that we need to hold accountable and we need to think about in terms of governance of our health systems. And one of the ways that we've sought to do that, we launched this commission, the Lancet, looking at the investing in the health and future of Nigeria. And one of the key recommendations, actually top recommendation, was that we integrate planetary health governance into thinking about how we build health in a young country. Because we know that if we do that, we think about prevention, if we think about planetary health, we can actually, in the long term, get more gains. And the last aspect of the story is reconsidering innovation. I think it's immediately apparent that we will need to think things differently. And so I would say that we could think about innovation as 4 things, right? We could think about it as a social contract. As part of the community outreach, the work of Independent Stage during the first lockdown, I had an Insta Live event with an influencer in the UK. And I had one question that was thrown at me and I was stuck on. I said, why are people so obsessed with getting us vaccines? Why are they not obsessed, if we know that obesity increases our risk of dying from COVID, why are they not as obsessed about getting us access to healthy foods? Why are they not as obsessed about getting us access to healthy public space? And I didn't have an answer because it was true. And you can see how centering health in how we build cities can build the trust that we need. I'll go into that. So the call for action there is really commitment to designing and financing health into cities. The second is participatory integration. And we've done some work with young people, with high school students, measuring asking them to measure on their journey from home to school aspects of the environment that influence how they eat, that make it easier or more difficult for them to eat healthily, easier or more difficult for them to be active. And we work with them to then design solutions to address these challenges. We have to include young people in this way. And I was speaking to a resilience officer in a city, and she said, you know, our biggest threat to resilience is disenfranchised youth. Because if we are not including them as part of how we think about cities, we're missing a trick. And we also have to think about how to integrate health into all policies. So this was some work we did in Cameroon looking at policies for physical activity. And for example, we found that transport policies did not have a mention of physical activity. If we don't have policy coherence and integration of health across all policies, we miss a trick. So that call for action is generating the evidence for inclusive urban health governance. The penultimate slide, Zhao is looking at me and I'm ignoring him. The penultimate slide is thinking about innovation as activism. This is a picture in the middle there. I was cycling a couple of weeks ago in Kisumu in Kenya with the Kisumu Bicycle Club, and I was talking to them about the activism and advocacy they had been undertaking over the last couple of years to try to get cycling infrastructure in the city, given the risk of injury and the safety risk they were encountered. And they had some incredible stories. We were actually cycling with air pollution monitor to understand what the exposure to air pollution was on their route. And so really we could think about this as enfranchising citizens to generate evidence-informed activism. And finally, and this is really important, we think about innovation as human potential. Because when we talk about these types of data, we talk about these types of infrastructure, it's really important that we're not leaving earlier career researchers behind, and in these contexts that we're developing systems that also build the pipeline of researchers that are able to work across these boundaries. So that work, some of that work is happening, and we're bringing all of these realities together and looking ahead, build a Pan-African citizen sensing infrastructure that brings together these different tenets of health, urbanization, and innovation to create healthy cities. This is my last slide. This is my last slide. Kairos. Honestly, you're going to want to hear this. Yeah, you're going to hear it. Kairos is an ancient Greek notion of time, right? It is different from the chronological time, or the sequential time that we think about. And it describes more opportune time for action. It's been described as comprising of understanding the audience that needs to be convinced, tackling the constraints to making that change, and critically, the exigence, that inherent pressure to do something urgently about a situation. We are living in very challenging times at the moment, but societal disruption does offer an opportunity for uniquely particular and radical action to reshape the ways that we have been doing things before. And if we are to harness the exigence and the kairos time we have now, as well as to look at how we can generate new kairos, we can generate new opportune times for action, I'm super confident that we can harness urban development to future-proof our cities, but also to health-proof the future of our cities, of our countries, and globally. Thank you very much.